are set out vaccines in the midst of a COVID-19 surge. The 100 initiative driven by WHO, UNICEF, and the World Bank is supporting over 100 countries to conduct rapid readiness assessments and develop country-specific plans for vaccines deployment. And we have hit our target. 100 countries have now completed this critical process, and the governments and health systems are on standby for global vaccine rollout. We're ready. COVAX is ready. Countries are ready. The time to deliver vaccines equitably is now. This is a very dangerous time in the course of the pandemic, and I do not want to see people become complacent as vaccines are starting to roll out. Over the past few days, we have seen some of the highest numbers of deaths recorded at any point in the pandemic. This is happening because over previous weeks, there has been a lack of compliance with what health authorities are advising in several countries. The virus has taken advantage of this and is spreading at an alarming rates in some countries. You might think that it wouldn't happen to you, and that you don't need to comply with the measures. The problem is that before you know it, not complying a bit becomes a habit. People you know mimic the behavior, and the whole system breaks down. Not complying with recommended measures gives the virus opportunities to spread, putting you and your loved ones at risk for infection, and for more people to develop severe disease, and for more pressure to be put on health workers. People need to know that they can personally stop the virus, and they need to know that the virus can stop with them. If I said one thing to people in areas where there are high numbers of cases, it would be to do all you can to avoid mixing with people from other households, especially inside. Because the virus thrives when people gather in groups, especially inside, where people are less inclined to physically distance, wear masks and hand wash, and where windows aren't open and there is not adequate ventilation, which means everyone is sharing the same air. In this difficult period, it's best to meet virtually, but if you have to meet others, do it carefully and with the right precautions. Meet outside wherever possible. None of us are exceptional, and the more we can break the chains of transmission and stop the virus ourselves, the more we will avoid severe cases and tragic deaths. This year is the year of the health and care worker. Let's show our respect and appreciation for health workers and care workers by protecting each other and vaccinating all health workers everywhere now. Remember, ending this pandemic is one of humanity's great races. And whether we like it or not, we will win or lose this race together. I thank you. And Fadila, back to you.
Thank you, Dr. Tedros. I will now open the floor to questions from journalists. I remind you that you will need to raise your hand using the icon "Raise Your Hand" to get in the queue. I would like now to invite our first journalist, Jeremy Lunch from Radio RFI, Radio Internationale. Jeremy, can you hear me?
Yes, Fadila, can you hear me?
Yes.
Thank you so much. Good evening. A quick question on the new study that suggests that the Pfizer vaccine protects against the new variants of the COVID. I would like to know if WHO has more details on that, and And what about the other vaccine, probably AstraZeneca and Moderna? Do you have infos that they too protect against the new variants? Thank you so much.
Thank you, Jeremy from Radio France Internationale. I would like to invite Dr. O'Brien to take this question. Dr. O'Brien.
Thank you for this question. We're looking into this. It's very recent information.
Out the signal from the virus as it evolves, whether new versions of the virus evolve that are of more concern for us in terms of our ability to control it or in terms of its severity. And again, just to say, the governments of the United Kingdom and of South Africa and others, Nigeria and other countries, are doing a fantastic job in stepping up on this issue of genetic surveillance and monitoring this at a much more enhanced level. And therefore, it's really important that when people call this a UK variant or South Africa variant, that we're not assigning values to these countries. These countries are not the cause of this problem. They're actually defining solutions by giving us the information that we need, and they should be commended and lauded for having invested in the kinds of systems that allow us to do this kind of monitoring. We should be following their example rather than looking at these as problems generated by or in South Africa or in the United Kingdom. The government, the public health, the labs, the clinicians and others in those countries should be, and I think South Africa is a beacon in terms of the comprehensiveness in the way South Africa has been able to pull together data from many, many different sources, again shows that this old idea of the North-South divide, that countries in the South can't do as well as countries in the North when it comes to doing this hardcore epidemiology and lab. This is about access to technology. Other countries in the South can do this as well. They don't necessarily have access to the technology and the training and the resources to do it, but South Africa has clearly shown, Nigeria have clearly shown, that if they have those resources, if they have access to these technologies, they will get on and do exactly the same job as is done in the North.
Thank you. I would like now to invite Catherine Fioncan-Bokonga to ask the next question. Catherine, can you hear me?
Yes, thank you, Fadela. Thank you for giving me the floor. My question is regarding the types of vaccines. If I can express myself, sorry, because I'm not a scientific. You have Africa that has problems to get access to the vaccines for the moment, are turning to the Chinese Sinopharm vaccine, and the Guinea started vaccination with Sputnik 5. So could you give us more information about those vaccines and also maybe the price? Because if I understood, the vaccines like Pfizer and Moderna that are using a new technology are 10 times more expensive than AstraZeneca, Oxford, or the one that are using a more traditional method of vaccine. Thank you so much for your answers.
Merci, Catherine. I would like to invite maybe Dr. Aylward to start.
Sure, thank you, Catherine. So you've asked about the types of vaccines. Now, Dr. Tedros in his opening comments highlighted that there's 42 countries around the world that we know are now vaccinating with COVID-19 vaccines. The majority of these, of course, in the industrialized world, and there's been very limited, in high-income countries and a small number in the upper middle-income countries, about 6. And there's very limited, if any, vaccination. A lot of what you've referred to are actually plans, not actually the rollout of products yet. And sometimes just exploratory discussions. But in the places that have started vaccinating, there's been 6 vaccines that are in use right now, among them the ones that you mentioned. And these are a range of vaccines, from mRNA vaccines, as you said, all the way to inactivated vaccine products. At this point, we're aware of 2 of those vaccines that have gone through stringent regulatory authorities in multiple countries, 1 approved by a stringent regulatory authority in 1 country. 1 has been, let's say, emergency use listed by WHO, and that is the Pfizer product that we've seen. Others in the pipeline now for evaluation very, very rapidly. We are aware that some countries have made decisions to proceed with vaccines that have been approved through other mechanisms. We recognize that, and we are continuing to work with both the countries to support the decision-making that they may make in that regard and understanding the issues around that. But we're also working very hard with the companies that are producing these products to make sure that they can be assessed by WHO through its regulatory support processes. So in the process of looking at those products, as you know, we are not in a position to provide a perspective on vaccines that are in use that we've not seen the data on. And at this point, as I say, the vaccine that we have seen is the Pfizer vaccine. We have all of the data on that. We also recognize, of course, in this exceptional circumstance, vaccines that have been approved through stringent regulatory authorities, and now those are the Pfizer vaccine, the Moderna vaccine, and then 1 country having approved 1 other vaccine at this point through a stringent regulatory authority. I think Mariangela wanted to add.
Can I just complement from the regulatory side? First of all, countries have the autonomy to, according to their legislation, to issue emergency use authorizations for health products according to their own legislation. But WHO does have a process that most of you are aware of, which is the pre-qualification process. And in the case of vaccines, new vaccines like the COVID vaccines, we do an emergency use listing assessment. We have issued an expression of interest, received 13 valid proposals since October. And besides the Pfizer vaccine, who was already listed by WHO, we do have other products that are at advanced stage. And specifically in the products that you have cited, we have received already, and this information is public, it's published in WHO's website. We have received, for example, the full dossier from Sinopharm, who has finalized a phase 3 trial, and it's been authorized in some countries. We are in the process of receiving the complete data from AstraZeneca, from the Serum Institute, and we expect to receive additional data from the Gamaleya, which is the Russian producer, before the end of January. So this is just to say that these products are currently being assessed by WHO, and this is important not only because many countries rely on WHO's assessment for authorizing the use of the product in their own countries, but also because it helps the international procurers like UNICEF and others to procure the vaccines that have been assessed by WHO. Thank you.
Thank you. I think that Dr. Aylward would like to add something?
Yeah, I just also want to come back in on the point that when people ask our opinion on these products, that I'm sure you, the journalists with us today, will appreciate for us to provide an opinion on a product that we've actually not seen and seen the data behind would be inappropriate and unfair to those asking the opinion. We also have to be very clear, though, that's a neutral perspective, right? Some of these products may turn out to be great products, extremely important in the battle against COVID-19. And this comes back to a point that the Director General made in his opening comments. We've put together a fantastic facility to help make sure vaccines get rolled out equitably around the world. The fundamentals are completely sound. That mechanism can only work if vaccines come into it and go through it, as well as money. We don't print money and we don't make vaccines. This is where we need the manufacturers working with us, and we need the countries, the donor countries and others working with us and working together. If a company does not submit the data that we need, it is slowing equitable access to vaccines around the world. If a company doesn't sign and work the deals through with us, and if we don't have the financing to do it, they're slowing equitable access. And the Director General, I think, was very frank about that today. And what we're calling for, and there's a frank call to action in the Director General's speech, is access to the data on all of these products in real time as it's coming out, so that we can ensure that we can provide a perspective on these products as rapidly as possible and get them out equitably around the world. You know, Michael asked an excellent question earlier, and then Maria was responding to it, talking about the tools. And the problem we have is the tools aren't equitably distributed. Look at the map of the world. There's a huge part of the world that's not vaccinating yet. 50% of the high-income countries in the world are vaccinating today. 0% of the low-income countries are vaccinating. That is not equitable access, especially when we know, and Mike made this point, that the people at risk of dying are older people. There's older people everywhere in the world. The people at risk of most exposure to this are those frontline workers. These people are working around the world, but they're not being protected at the same rates. That's why we've created COVAX. It is there. It works. What it needs are the vaccines and financing. We have part of the financing in place. We are ready to go, ready to get started. We need the manufacturers working with us, and we need the countries working with us. We have to change the color of those maps this month.
Thank you, Dr. Aylward. I think that Dr. O'Brien has also something to add. Dr. O'Brien?
Yeah, just two things to add to what has already been said by Bruce and by Mariangela. The two additional points I want to add have to do with transparency and have to do with policy. So in addition to the procurement, so the money that Bruce has spoken about and the need for the data on regulatory issues, in addition, countries do rely on WHO for recommendations on how to use the vaccines, especially because these vaccines are in limited supply in the initial phase of rollout. We know that all over the world. Choices do need to be made about how best to use them to their best impact, their most maximum impact, especially in these very early phases. And we do need to see the data on these products in order to establish policies, as SAGE did at the beginning of this week. The second thing is transparency on information. Our understanding of which countries, where they're using vaccines, what deals are being done is extremely important in order to help with this whole process of equitable allocation and equitable access to vaccines. And we're also calling on countries and manufacturers to be clear about and transparent about where vaccines deals are being done, the doses that are being arranged for use in various countries, and then their actual rollout. And having this information over time is really important for WHO and for the world to respond to this crisis in a way that will have its maximum impact. So I think those are the two other points to make here. Thank you.
Thank you all. I would like now to invite Christopher Hamil Stewart from Arab News to ask the next question. Christopher?
Hi, can you hear me?
Yes, very well. Go ahead, please.
Great, thank you. I wondered if the WHO had a response to Iran's announcement today that it would ban the import of US and UK vaccines.
Thank you, Christopher. Dr. O'Brien, do you want to respond to this question, please?
As Bruce has just indicated, there are a number of vaccines on the market that are available around the world, and especially in the COVAX facility. The importance of having a portfolio of vaccines that serve the different needs of different countries, and especially serving the different needs of delivery situations. We know from of the different products that we have. Some require an ultra cold chain, some require a frozen temperature that's not ultra cold, and some require refrigeration. So we have a lot of variability of the products in terms of a range of their characteristics. I think the other important thing to say in relation to this is that there is manufacturing going on of these products in different places around the world. And that provides greater or lesser access to different vaccines. And so I think the range of needs of countries and choices of countries is served by having this portfolio of vaccines where there can be matching of vaccines to the delivery needs and the characteristics that countries have for the access to those vaccines.
Thank you. Dr. Aylward, I think, wanted to compliment.
Yeah, thank you, Fidela, and thanks, Kate. Super important questions, right, about vaccines and vaccine access that we keep coming back to, and we're going to come back to them more and more as we go forward over the coming months. And the important thing to recognize is that every country in the world is making decisions about what products it does and doesn't want to use and doesn't prioritize for different reasons. And one of the things that we've been doing as part of the COVAX facility is going out and talking to the 90 plus countries that are what we call our AMC countries and our other participants. We have 190 participants, and we get back a wide range of preferences on what kind of products they want to use, whether they want to use more than one product or two products, which particular products they may want to use, and for a whole wide range of reasons. So, I come back to that perspective that the Director General comes back to again and again about the importance of not singling out individual countries or issues and really focusing on how do we get these products to as many countries as necessary. And, one of the beauties of the COVAX facility, the way we've set it up, is we've got a very broad portfolio of products. We know we have a broad range of clients that we're working with through that, participants. And what we're going to do is work with them to get that right balance of products. And again, it's one of the reasons that this facility is such an important part of the global solution to equitable access and rollout. Every country needs these products. Every economy needs these products right now. And it's really time to put any kind of politic aside and make sure that vaccines get to the people that need them.
I think Bruce said it. The DG has said many times in the past, let us not politicise this virus. Please let us not politicise this vaccine either.
Thank you. I would like now to invite FA Antonio Brotto to ask the next question. Antonio, can you hear me?
Yes, can you hear me?
Yes, very well. Go ahead, please.
Thank you, Fadela, for taking my question. So the global figures for daily cases of COVID in the first days of this year are not higher than in December, despite the fear to a spike in transmissions after the Christmas and New Year holidays. So do you think this is a good sign, maybe a sign that the vaccines are already working, or is it too soon to be that optimistic? Thank you.
I think it's way too soon to be that optimistic. Look, the reality is for the third week in a row, we've had over 4 million cases reported each week in this pandemic. There's been a very slight decrease in the last week, but again, the transmissions that would have occurred over the holiday period will only be pushing through into the numbers that we're seeing this week, next week, and beyond. So no, it is way too early to interpret that. What we do know is, certainly in the Northern Hemisphere, there's been a tremendous amount of mixing of people over the last number of weeks, and as has been previously stated, we're dealing with the complications of variant strains and potential increases in transmission. So no, there is nothing to suggest that. The numbers of vaccines that have currently been distributed will have had zero impact on transmission dynamics at country level. They maybe are saving lives as we speak, and we're very grateful for that, but they're not going to affect transmission dynamics for a very long time. Bruce?
If I might, Fidel, just to the point that Mike meant, the last point was so important, the last part of that question, right, about whether or not we're seeing the impact of the vaccines already. And the answer is no. These vaccines and the way we're rolling them out have two really specific goals. Our first, save lives, get them to the people at highest risk of dying of this disease. We know those populations. They're the older people in our society. So important that they get protected early, right? We know the people who are getting exposed at a disproportionate rate, and especially those frontline workers who unfortunately have been given their lives to try and save lives during this crisis. We've got to protect those people first. So that's what our initial goals are. We do not have the volumes. They don't exist yet, and we also don't know all the mechanisms of these vaccines to be having an impact on these curves much too early. And as we look into our crystal balls, right, we're not going to see that in the coming 6 months. This is, as we scale up these vaccines over time, it comes back again and again to what Mike has been saying, the Director General. This is not going to work if people are mixing at high rates, if they're not using masks, if they're not doing all those things that are so important. Vaccines have a lot of promise, but what we need to do now is identify the cases rapidly, the mild cases, the moderate cases that are driving this crisis, get them isolated, identify the contacts, get them quarantined. That, plus the rollout of these vaccines, is what is going to see those curves change. But it's not going to change just by those drops of vaccines that are going out at the current rates. And they're only going to go out. We've seen all the challenges to getting the numbers up, even in highly advanced environments. So it is absolutely imperative that the other parts of this response work and we start applying the knowledge we've learned in the 12 months that we've known this virus.
Thank you, Maria.
Yes, thank you. So I have to, come in on the aspects of the consequences of our action, and the Director General said it in his speech tonight. The results of our actions over the last 5-6 weeks is what is resulting in increased case numbers, in increased hospitalizations, and in increased numbers of deaths. And that will continue for the coming weeks and the coming months if we do not change our behavior. You have to follow the local advice that is being advised in the areas where you live. Governments need to enable populations to be able to do so. If you are asked to stay home, we understand that is challenging in many different respects of our daily lives and our social lives. In many situations, people need to work to put food on the table, so we need people to be supported in the actions that are advised by governments. But we also need individuals to think about what they do every single day. The decisions that you make every single day about what you want to do versus what you need to do matter. They can have consequences of increasing transmission, and they can have consequences of decreasing transmission. Please help be part of the solution of decreasing transmission. There are actions that you can take right now that limit the exposure to yourself and to your loved ones. And maybe you don't think that COVID-19 is a big deal for you, but it can be, because we know that this virus is dangerous. This virus can cause severe disease, and it can kill you. And maybe not you, maybe someone that you love that has an underlying condition or is of older age. This is serious. And at the present time, in many countries, we are seeing increased transmission where we can turn the corner by putting in the measures at home, staying home if you're unwell, staying home and not mixing with other families, postponing that trip that all of us want to take, making sure that all of the actions that are put in place. If you are asked to be in quarantine, please stay in quarantine. You are adding to the solution here. If you are a case, and we hope there are no more cases, but if you are a case staying in isolation, making sure that you receive the adequate care that you need in medical facilities, allowing the research, the community workers to do contact tracing and cluster investigation, and the technicians to do those lab tests and get those test results back quicker. But all of these actions can reduce transmission, and we are pleading with everyone to do everything that they can to be part of the solution to break those chains of transmission. It is within our hands. Vaccines and vaccination are another powerful tool, but it will take time. In the meantime, there is much that you can do every single day. So please help be part of the solution.
Thank you, Maria. I think that Dr. O'Brien wanted to say a few words, Dr. O'Brien, you have the floor.
Yeah, I just want to add to really important things that everybody has said about this, Maria in particular just now. But we've been saying about the vaccines, even anticipating that they were coming even before that they came, that it was not going to be a flip of the switch. And even as they roll out, we actually don't have the information right now about the magnitude, the degree to which they actually interrupt transmission. And so although we do have evidence now about the degree to which they can protect against disease, and especially severe disease, that does not necessarily imply that the same magnitude of impact will be on the protection against transmitting from one person to the next person. So I just want to reinforce that even for people who have been vaccinated, and there will be an ever-increasing number of those people, that does not mean that people who have been vaccinated are now fully protected from getting infected in their nose. They are very substantially protected against themselves becoming ill. But we have evidence that a new study with 59% estimate from a model of the transmission is coming from people who are not symptomatic at that point in time. So we really do need, as we roll out the vaccines, to remember, as Maria has said, this is just one tool, a new tool, and a very powerful tool in the toolkit, but it doesn't mean that we should step back. In fact, we should be escalating and improving our use of all the other tools that we already have. Thank you.
Thank you, Dr. O'Brien. Antonio's question was the last one for today. Over to you, Dr. Tedros, for final words. Thank you.
Thank you. Thank you so much, Fadila. Thank you all colleagues from the media for joining, and look forward to seeing you in our upcoming presser. Have a nice weekend and Happy New Year.
Thank you, DG. Just reminding journalists that we will be sending the audio file and the DG speech right after this press conference. The full transcript will be posted soon on the WHO website. As usual, do not hesitate to contact the media team if you wish to ask any follow-up question. Thank you and have a nice weekend.